Tolkachev, and I'm from the Surgical Dermatology Group in Birmingham, Alabama. I want to take a minute to discuss our recent article in Mayo Clinic Proceedings called Understanding Mohs Micrographic Surgery, a review and a practical guide for the non-dermatologist. We brought together a group of experts in the field of dermatology as well as Mohs surgery to discuss how we as a team with the primary care provider can treat patients with non-melanoma skin cancer as well as melanoma with the use of Mohs micrographic surgery. This group of experts includes those that have run successful private practices as well as a group of experts that have been heads of their academic department in all over the United States. Non-melanoma skin cancer is the most common malignancy in the United States and Europe, and the cost of treating non-melanoma skin cancer is rising. Some of the takeaway points are that Mohs surgery has become the standard of care for the treatment of non-melanoma skin cancers and is rising in the utility for the treatment of melanoma. Mohs surgery spares the most amount of normal tissue and has the highest cure rates for many of the non-melanoma and melanoma skin cancers. Figure 1A discusses the use of Mohs micrographic surgery and its technique, and it shows how the full peripheral and deep margin can be analyzed by a Mohs surgeon. Figure 1B shows a standard wide local excision with bread loaf histopathology, and it also allows you to see how tumors can recur if the entire margin is not evaluated and false negative margins may be reported. We discussed the cost effectiveness of Mohs surgery as opposed to other treatment modalities. Figure 2 shows an actual patient with a squamous cell carcinoma of the preauricular cheek. The Mohs surgeon here was able to take the squamous cell carcinoma off the perineum and reconstruct this with a large bilobed transposition flap, and then in follow-up he was able to see that the patient had full preservation of cranial nerve 7 function. Figure 3 is one that a non-dermatologist or a general practitioner can use as a way to guide how to refer patients with non-melanoma skin cancers or melanoma to a Mohs surgeon. Table 1 shows the cure rates for selected non-melanoma skin cancers as well as melanoma and compares it for Mohs surgery as well as wide local excision. Table 2 gives a cost comparison of multiple modalities used to treat non-melanoma skin cancers. Patients with cutaneous malignancies, including those with organ transplantation, hematologic malignancies, often require multidisciplinary care. Primary care providers and non-dermatologic specialists should be aware of the role of Mohs surgery in the treatment of patients with non-melanoma and melanoma skin cancers. We hope this article will serve the members of the multidisciplinary care team in order to most effectively serve patients with cutaneous malignancies.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.